This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.
We are here with the owner of Bespoke Physical Therapy and Wellness. Excited to have Lou Campasano joining us here again, our PT, and so much more. Hailing from beautiful Greenville, South Carolina. Excited to talk more about the physical therapy that he does, and really pretty impressive what you're doing and helping so many, whether it's a sports injury, whether it's in regards to injury prevention, and helping so many, athletes and regular people with their bodies. How are you today, darling?
I'm doing well, Jill. How are you?
I'm doing great, thanks. First and foremost, please introduce yourself to our listeners to start. Thank you.
My name is Lou Campasano. I am a physical therapist with over 20 years of experience. I have a company called Bespoke Physical Therapy and Wellness, where we specialize in mixed martial artists, active adults, youth athletics, and wellness consultations.
Got it. And let me ask you, I know we've got to know you a little bit on a personal level last time we spoke, but for those that may not know, just a little bit of your, can I say, your training behind this. Obviously, you have a lot of experience in this field, and it's just good to get a quick little, overview about the work you're doing before we go today and dive into manual therapy. I know that's our topic.
Sure. Well, I was an athlete all throughout grammar school and high school. I had an injury that drove me to physical therapy. It got better real quickly, and I decided to take on the profession as a physical therapist and athletic trainer. Um, like I said, I've been doing this for over 20 years, working with all people of all ages. I began mixed martial arts training, oh, well, about 17 years ago. Muay Thai, Jiu-Jitsu, wrestling, and continue that today. And that's what led me to be here at the UFC gym in Greenville. And there was an opportunity for me to get some space here, and I opened up actually here in this building just earlier this month.
Oh, congratulations. Well, thank you
Thanks.
for joining us and for being here. Let's break down today a little bit about manual therapy. Can you give us a little overview and tell us what that is?
Sure. Basically, it's hands-on therapy to help create change in the body. Something that goes beyond just doing exercise. We all know that a lot of times weakness will create an injury, or
Yeah.
lead to an injury, overuse injuries, tendinitises, muscle strains, that whatnot. But sometimes, you really have to get your hands on the person, help them mobilize that joint. So it includes a number of things, joint mobilizations, soft tissue work. I usually do soft tissue massage, myofascial release, stretching. Um, and when I say mobilizations, they're not those high thrust manipulations that you'll see at a chiropractor's office, but gently mobilizing the joint in different directions. A lot of people don't realize that your joints have multiple planes of mobility, and surrounding those joints, making those joints, stay in place are ligaments and muscles. And sometimes those have to stretch because we can't do it on our own with our normal mobility or normal movement patterns. So you get in there, you start mobilizing those joints, you start freeing up those joints so that they can move a little bit better. Um, and so what we'll do is we'll start by maybe doing a little bit of stretching, or finding those deep tissues that are tight or painful, and start working on those at a superficial level,
Yeah.
and start working into moving that joint, maybe go into a deeper soft tissue massage, maybe some myofascial release with sustained stretching or sustained pulling. I'm sure you've probably heard of Graston techniques, using tools to help scrape the tissue to help release that tension. Sometimes that's a little painful, but the results are really good. I would say that I probably prided myself on the fact that I didn't let a person get off my table who I
Mm-hmm.
put my hands on. And throughout the my experience, the people who came to me were the people who really enjoyed that manual therapy. They would ask for me. They would see other therapists in the building, and next thing you know, my schedule was filled up because people like that hands-on therapy.
Yeah, absolutely. Well, thank you for sharing this. And we're excited we're talking here today about manual therapy. And we're going to move on into a little bit about soft tissue mobilization, what that is, muscle energy techniques, and so much more. And if you are just tuning in, Lou Campasano, don't forget, he is the owner of Bespoke Physical Therapy and Wellness. So we're excited today to talk to him and break down, more of the work that he's doing to help so many people. All right. So what's next on our list?
You had mentioned soft tissue mobilization.
Yes.
So, like I said, I kind of
Good.
prefaced it, but, we go from superficial to deep. So we'll start by, assessing the skin and see how tight is that skin? How is it
Mm-hmm.
bound down to the muscle tissues? If it is, then we're going to do something like skin rolling or myofascial release to help separate that skin from the fascia or from the muscle to allow that skin to move. If the skin can't move well, then you can't move well. And then we start on that superficial and we start going a little bit deeper. If somebody has scar tissue, we might do
Mm-hmm.
something a little bit more deep, like cross friction massage, where we work across that scar tissue and try to break that up, especially if they're post-surgical. Um, because we want to get that mobility. If that skin isn't moving, if the tissues just below the skin aren't moving, we have to free that up. And we could use, you know, um, instruments to help do that. Sometimes my fingers just aren't strong enough, so we'll use some instruments to help do that. Again, like I said, it's a little painful sometimes, but the
Mm-hmm.
results are incredible.
All right. Well, also looking into, the next step, you want to talk about muscle energy techniques? Can we talk about
Sure.
that and what
Yeah,
that
sure,
is?
absolutely. So what muscle energy techniques are is we basically find counterbalancing tissues and we start mobilizing that joint. All right. So for example, if you have a pelvic um, imbalance, let's say your pelvis rotated, okay? And a lot of times that presents with pain in the low back or into the hip or pelvic region. And so what we'll do is we'll find out where that rotation is going, and we'll take opposing forces. So let's say your right side is rotated backwards, all right, posteriorly. We'll take the muscles in the front of your right hip, and we'll have you contract those muscles isometrically while you concurrently contract your extensor muscles on the other side. So you have hip flexion on the left side or on the right side and hip extension on the left side isometrically. And what that's going to do is that's going to gently pull that pelvis back into the right position. So that's
Okay.
an example of your muscle energy technique. I will say that every person that comes into me with low back pain, I will screen just to see if their pelvis is rotated or not. And I would say over 75% of the people I see do have a rotation based on muscle imbalance, um, pelvic instability, low back instability. And so once we create and correct that, we have to make sure that we give them the right exercises to appropriately hold that into position. Because if your foundation of your home isn't level, just like your spine, it sits on your pelvis. So if your pelvis isn't lined properly,
Mm-hmm.
your low back and your spine isn't going to sit properly.
Got it. Ooh. And again, you may remind me of my horrible posture as we're speaking here today, because Lou, of course, you seem like you're sitting straight up. I find I tend to hunch and slouch, and thank you for reminding me of my posture because now it's hurting a little bit. Okay, okay.
Yeah.
Oh my goodness. All right. So also with these muscle energy techniques, right? You mentioned like what are some of the things, just curious, that we should, can we do this at home a little bit? Like any type of stretches that would help us with this?
Sure. So a lot of times, and because I find that I do these mostly with the pelvis, um, I want to see what direction you're going in.
Okay.
Because if the pelvis is out of position and you're continuously doing something like, say, you're a runner and you're continuously running on that and you're jamming that pressure is pushing you in further into that awkward position, you might find yourself with hip tightness or, like I said, low back pain over the sacral region. And so what happens is once we determine which direction you're going, I can provide home exercises that you could do to help de-rotate, put yourself back into the position. A lot of times on the first treatment, people say, "Hey, can I do this at home?" But if I give it to them at home on that first treatment, a lot of times if they go do the same thing, they may pull themselves in the wrong direction. So we
Yeah.
have to determine the pattern at which you go out. So usually it takes two or three visits for me to really feel confident that I can give you something that you can do at home that's going to work properly.
Got it. All right. Well, thank you for that. Let's also move on over, if we can, to talk about this trigger point therapy, which is how you're identifying these trigger points. And tell me
Yeah,
specifically
so
how that helps reduce pain.
yeah, we go in and usually by palpation,
Mm-hmm.
by hand, we go in with our hands and we feel that tightness. We can go in deep, start palpating, and with firm pressure, we find that trigger point. And there's a couple ways we can reduce that. Um, we can go in there and just put firm pressure on that. And what that's going to do is that's going to stretch that tissue. And
Okay.
in our muscles, we have these little receptors, and they tell the muscle how long they should be. Okay. So let's say you have pain and your muscle is in spasm. We'll go in there and we'll start stretching that tissue by putting firm pressure there. And we hold it there for a little bit. And as we release that tension, the muscle will relax because it's going, okay, now I know I have to be at a longer tension, not at this short piece, which causes more tension and causes
Yeah.
more pain. But let's say that trigger point release with my finger doesn't work. A lot of times I'll go in and I'll do dry needling, and where we go in and we put a little needle in there, an acupuncture needle. We go in there and we get a quick twitch response, or which will help relax and relieve pressure with endorphins. So your body releases endorphins, and with that quick twitch, it'll help that muscle relax. Or we can go in there and we'll put that needle in there and we'll just twist it up a little bit enough to catch that fascia. We'll tighten that fascia up and let it sit there for a little bit. Sometimes I'll even use electrical stimulation, like a TENS unit, to help make you feel a little bit of stimulation there to help release that pain again. And then when we take that needle out, that muscle just relaxes and
Got it.
helps guide us and give you enough relief to get going through your exercises to help create the change that we need.
And it's funny you mentioned the TENS unit. That's right. That was invented by Neil. What was it? I used to speak to him on the show. I can't think of his name now. You might know it.
Oh
Uh,
boy,
yeah,
you're going
yeah,
back
yeah.
20 plus years. I don't know his name.
Yes, he was very old, but he was an amazing doctor. He invented the TENS machine. Neil, I can't think of his name, but I learned so much about that from him, and that's something that's still in the works. People still use that, right? Could you
Oh,
explain what
sure.
that is?
Yeah. Yeah. People
It's
love it.
it's triggering. Could you the muscle stimulation in a
So,
sense?
so basically, I mean, TENS unit is it's transcutaneous electrical nerve stimulation. And what it does is it utilizes nerve pathways. So light touch gets to the brain faster than pain. Okay, you have two different nerves that help that pain travel or helps light touch travel. And so, just for example, if you bang your elbow and you rub your elbow, it makes it feel better. That's because you're basically blocking the pain from getting to the brain because your light touch from the tens gets to the brain faster. So you're basically blocking that pain to a certain degree. You're not going to get rid of it all the way, but you're gonna block it to a certain degree to help reduce that pain. And there is a pain spasm pain cycle. So once you have pain, the muscle goes into spasm. The more spasm you have, the more pain you have. And so we want to try to break that cycle. And so TENS is one proponent on doing that.
Good. Thank you so much. Also,
Yeah.
let's move on down, and you wanted to talk a little bit more about something I'm not even sure to pronounce. PNF. What is that? What is PNF?
Proprioceptive neuromuscular facilitation.
Thank you for
And
that. Thank you.
we use that a lot for improving range of motion. Let's say you have a person who's coming off of a hamstring strain. They've been limited in their mobility. Every time they go to stretch their tissue, it's pretty painful. It's really tight. And what we do is we utilize that muscle to stimulate. So what they'll do is I'll have, maybe I'll put them on a stretch position. Nothing real painful, but we'll put them in that tight position where they feel that muscle really tight. And what I'll have them do is I'll have them actually contract against me. So I'll
Mm-hmm.
hold that position and they'll
Oh,
contract isometrically into the
okay.
muscle. And that they'll hold that for, I don't know, 3 to 5 seconds. I'll have them take a nice deep breath. As they breathe out, I have them relax that muscle. And that allows us to go just a little bit further. It actually helps that muscle release through active inhibition. And so the muscle inhibits after that contraction and allows us to go a little bit further, stretch that muscle, and they'll be able to increase their mobility a lot faster by utilizing that. We can do that with any muscle. You can do that at the shoulder, the hip, the knees, the ankles. It's just a matter of finding the muscle, actively pushing against it as they contract, and then bringing it into a further range of motion.
What about strain, counter strain? What is this?
Strain counter strain, man, that is just so it blows my mind. The first time I used it, it blew my mind because the results were incredible. I love to use the shoulder blades as an example. Everybody has this pain in their upper back, right between their shoulder blades. And so what you have to realize is the muscles run from the spine to the shoulder blade. Okay. So let's say somebody goes to rub your back and you have these knots going all along the inside of your shoulder blade, in between your spine and your shoulder blade. There's all those little knots. And what we do is we take that shoulder blade and we have the person relax as much as they can. And we draw that shoulder blade as close to the spine as possible. So we shorten the muscle. We put that muscle on slack and we hold it there for about 90 seconds. All right. And again, what we're doing is we're teaching those muscles that they have to be at a different length. And so we're resetting the muscle spindles, the receptors that tell that muscle how long they should be. And we hold that there for 90 seconds. And then after that, we take them into a nice, gentle, passive stretch, and we have them move it around again. And that relaxes that muscle. It resets the length, allowing that muscle to kind of move more freely and decreasing that muscle spasm.
Those that can hello, hello, for
We got
those that never used any of this, right? I mean, you're coming in and you're going to give that person that full assessment, and there's these different modalities, but you're using a lot of these different modalities on people, right? So it's really individual once
sure.
you assess
I
them
don't,
and decide, right? Or do they come in and say,
yeah,
I
I
want
don't
to
go
do
in there
this?
and go, okay, you're going to get all of these all today.
Okay,
A
got it,
lot
got it,
of
got
it
it.
depends on how much pain they have,
Yeah.
the kind of shape they're in, where their pain is. Some muscles respond better to certain things than others, larger muscle groups versus smaller muscle groups. So it really varies depending on the person. And
Yeah.
while I'm doing my assessment and as I'm doing things like the soft tissue stuff, I'm assessing to see what am I going to utilize with this person? What can they tolerate? If they're highly reactive to soft tissue work, well, then maybe I will do something like strain counter strain before I do something like a muscle energy technique or trigger point release. something a little bit more passive
Mm-hmm.
before, so that they can start healing because we don't want to cause more pain. The goal is to get them to have
Yeah,
less pain when they leave.
of course.
So we may start with some less aggressive things and then move on as they get stronger, as they can do more. We move into more aggressive techniques.
Perfect. And I know you mentioned about the integration, which obviously you are able to use different modalities here. Do you want to, talk about how how do you assess someone in a sense, for this?
Sure. So again, like, just like I was saying, as I'm doing the lighter techniques,
Mm-hmm.
I throughout that treatment, I'm trialing more aggressive things as I go into it and see how
Okay.
they respond to it. If they're jumping off the table with some firm pressure,
Yeah.
I might not go into dry needling, on that day. Um, but we basically like to see, what are they tolerating? And what is their response? As I'm stretching them, am I looking more for mobility and flexibility, or am I going to work on that joint a little bit more? So, first we have to determine, is it going to be soft tissue work that I'm going to be focusing on more than joint stuff, or vice versa? And that's going to determine how much I'm going to do. Um, maybe I want to relieve some soft tissue work, and I say, oh, you know what? Maybe cupping is going to be something that we're going to work on. And cupping is something where we go in and we basically put some cups on the skin and we suck that air out, and we
Mm.
kind of make that suction to their skin. That's going to do a
Yeah.
couple things. That's going to bring blood flow to the area, but it's also going to help relieve some of that fascial tension that I was talking about earlier. So
Yeah.
it kind of pulls that skin away from the muscle. And so from there, we could do something where we just leave it there. Or if we lubricate the skin, we can roll that cup up and down their back or up and down that tissue across side to side so that we kind of roll that skin away from the tissue and help create a little bit more mobility because maybe they weren't tolerating my hand pressure earlier.
Mm-hmm.
Might go to cupping or something like that. Maybe they're adverse to using needles. So we have alternatives that we integrate, based on how that soft tissue moves, based on how that joint mobility is. We kind of determine, based on how they're feeling, how they respond to my pressure, determines on what integrations I utilize.
Got it. And also, I just want to point out, this dry needling. Should we dive a little further into this, what this is specifically, and how this can also help? I mean, there's,
Sure, sure. Like I said, pain causes spasm, spasm causes pain. Dry needling is primarily a trigger point release. When we documented it's TRDN, trigger point release, dry needling. So we stick that needle in. Like I said, you get that muscle twitch and the release of endorphins. And then, what I learned and what I find works really well is we turn that needle until there's some tightness, some tension in the muscle. And we might do that along a certain muscle, depending on how big that muscle is. If it's like your low back, say, I might do, 4 or 5 needles up that muscle at different points where you're tightest. And then I might hook up some electrical stimulation there and let that kind of settle in a little bit. And then when we take that dry needle out, that muscle relaxes. Now, the thing about dry needling is I have some people, you have a parasympathetic response. So some people, they might get a little dizzy. They might
mm-hmm.
feel super relaxed. I mean, I had one patient who would walk in and she would need, 10 to 15 minutes to just kind of lay there and wake back up because she had such a parasympathetic response that she almost felt like she was really tired.
Wow.
Uh, afterwards. So she would kind of relax for a little while before she'd get in her car and drive because it is so relaxing to some people.
It is. Then you go into like the hypnosis state, right? Sometimes I do. I do.
Sure,
All right.
sure.
Well, we have a few more minutes obviously left in the show. And did you want to, dive into something
Well,
else a
I
little bit
will I will
further?
tell you the dry needling thing,
Yeah.
is a very niche thing right now. A lot of therapists do it. When I was in New Jersey, I wasn't able to do it because it really falls under the acupuncture realm. All acupuncturists do dry needling, but not dry needlers don't do acupuncture, if that makes
Okay.
sense.
Yeah.
Okay. And so when you go in, acupuncture is based on meridians. What we're doing is we're using neuromuscular type stuff here. So we're just doing muscular stuff. And for me personally, I came to South Carolina and I had hurt my neck moving into my home. Every
Ah,
time I turned my neck, my wife, who was across the room, could hear my neck creaking from the crepitus, the bones rubbing because of such tension in my neck. And I was stretching and doing everything I knew as a therapist to do. And I finally went to a colleague and said, "Hey, man, Dan, can you dry needle my neck?" And he said, "Oh, I've been waiting for you to say something because I seen you with the ice and the traction and the
hmm.
exercise while you're on break and stuff like that." And the first time he did it, it felt better. It was looser. The next week I went back to him and said, "Hey, can you do it again?" And I literally, Jill, I left there and I thought he messed my neck up. I went home, I told my wife, "Hey, I think Dan really hurt me when he did the dry needling."
Ah,
That whole night I was really tight. It didn't feel good. The next morning, Jill, I woke up,
wow.
everything was gone. Everything. I didn't have any problems, any pain, any stiffness. And I said, "Hey, I need to learn this. I need to go get
This
certified in
works.
this."
Yeah.
And I can't tell you how many countless patients I've helped progress through their process so much faster using these techniques. It's been incredible, especially on the neck and the back.
Amazing. Thank you. And the
Yeah.
and the cupping too, you mentioned is really amazing, right?
Yeah, I mean, Michael Phelps made that super popular in the
Hmm.
Olympics, with those big marks on his
And
back.
Was it Gwyneth Paltrow? Who was the
I
one?
think so,
Used to see
yeah.
them on the red carpet. Yeah, yeah, yeah.
Yeah. And these are techniques that work. That I mean, cupping is ancient. My grandmother used to do it with with oil, and she would light a candle and she would
Really?
use heat to suck the air out of suction out of the glass. And we use a little bit. We don't use fire in our office, but
Hmm.
we use
Yeah.
little suction cups and we suction that air out, and yeah, people get great benefit from it.
Amazing. Amazing. And also, in our last few minutes together, let's just, sum up. Obviously, what you're doing is amazing to help so many people, and there's a lot of different modalities as you kind of, walked us through today. And in conjunction with all these type of therapies, modalities, the truth is you can feel better. And that's what you're here to promote, right? The health and well-being of your clients and your passion and dedication in helping people. So
Absolutely.
commend you on
If
that. How did you
if
want to kind of wrap up for today's
if
show?
I can emphasize one thing, Jill,
Sure.
manual therapy is just a portion of what we do. Is it a significant portion? It is. It
Hmm.
really is. But ultimately, it's just a way to get you out of pain so that you
Yeah.
can progress your exercises, your strengthening and mobility. Because without the exercise,
Yeah.
without the strengthening, without the mobility stuff, it's never going to get better. You can come in and I can do manual therapy and you
Yeah.
can leave and you'll feel great, but you're going to be back the next week and you're going to keep doing that. You know, it is not the cure. This is just a small thing to do to help you progress with your exercises, progress with your stabilization, progress with the things that are going to help keep you from coming back.
Beautiful. Thank you so much, Lou. And how can we reach out to you, please?
Oh, yeah, you can reach me on my website, www.bespokeptw.com. You can call me at 864-920-0696, or you can email me at lucy@bespokeptw.com.
Perfect. Thank you so much for all the information and insight today, and wishing you another amazing, happy week. And all the people out there who are in pain, it's time to go out there and get started and get the help you need. And know that there are so many different techniques out there and people that are willing to help. So, especially if you're in your area, Lou, I hope they reach out. Thank you.
Thank you, Jill. It's good talking with you.
You too. Enjoy the rest of your day. Bye bye.
Thanks, you too.
This is the Global Podcast Network, where executives and professionals connect, share, and inspire. Stay tuned for the conversations that drive success.